This video is going to cover anatomy of the thorax via both CT and MRI, and so we'll talk about mammography as well as other internal structures within the thorax. So just a quick note, there's a couple of websites that I think are very good for learning the structures within the thorax via CT as well as MRI. So I would recommend checking out both of these. So there is a hyperlink to both CTIS-US in the slides that'll be posted, and then also to the MAOS website where you can use a real DICOM viewer and be able to scroll through a number of levels of the thorax. Actually, it'll be the entire thorax from superior to inferior, where you'll be able to then look at various structures that are all labeled, and you can also remove the labels on the MAOS website. So it's a very, very useful tool. I would strongly recommend that you make use of it. And again, there is a hyperlink that'll be available to you in the slides that are posted online. So recall, just like we talked about in the introductory lecture, that chest CTs are usually windowed, and they're usually windowed in two formats. One format is the soft tissue window, which is shown on your left. The other is the lung window, which is shown on your right. So remember that the lung window is going to allow you to better appreciate the lung vasculature, whereas on the left, the soft tissue window, this is allowing you to better appreciate cardiac structures, the bronchi, and trachea, and other soft tissues, muscles, etc., located within the thorax. There's also a bone window, which can also be certainly used, but oftentimes chest x-rays are sufficient for assessing bony structures. But again, you can certainly do a bone window on a CT scan without any additional radiation. If you're looking for something else, you can certainly check out the bones just to be sure. So as a rule, the sections in an axial plane are going to be 4 to 8 millimeters in thickness, but can certainly be less. So kind of keep that in mind as you're scrolling through a series of images of the thorax or any other part of the body via CT. Also, same thing with MRI, is typically you're going to be looking at 4 to 8 millimeter thickness slices as you go. And you also want to remember that when you're looking at a cross-section or an axial view of either an MRI scan or a CT scan, just remember that you're standing at the patient's feet and you're looking up into the patient. So the patient's right is going to be on your left and the patient's left is going to be on your right. So always keep that orientation in mind. So here's an example of a lung windowed CT scan where, again, you can appreciate the various structures within the lungs, especially in terms of the pulmonary vasculature. And notice on the patient's right, so on your left, you can see a lung nodule out in the periphery. So an easy way to identify a lung nodule like that is to remember that your pulmonary vasculature is going to get progressively smaller or more and more narrow as you move progressively more distally and apically as well. But just so obviously that's going to be an abnormality on a scan if you see some sort of dilation like that far distal from the origin of the pulmonary vasculature. So there's something known as unintentional blindness, which is a major issue. I alluded to this in the introductory lectures. So this comes from a study where 24 radiologists looked at CT scans of the lungs, and they were looking for lung nodules just like we did a moment ago. And each CT scan had an average of 10 nodules, and the radiologists were asked to click on each one of them. And then the last of the 5 CT scans had something unexpected turn up on the lung, which is actually the scan that we just looked at. And so when asked if they saw a gorilla on the final scan, 20 of the 24, 83% of them missed it. They did not see the gorilla. And so what this shows us is that if we're paying really close attention to one thing, we often fail to notice other things within our field of view, even very obvious things like a gorilla on a CT scan. So the point here is to make sure that you don't forget about your systematic view or review of a scan. You always want to have that systematic approach to any scan. And so when you're looking at an axial scan, again, just like you did on a chest x-ray, make sure that you look systematically at the various structures. Think about what level you're at, think about the 3D anatomy that you're seeing at that level. And so again, on this image you can see the gorilla indicated by the yellow arrow, and the upper left, or on the anterior left lung that you see highlighted there. So We talked about this before, the importance of anatomical planes, but I just want to reinforce it. So remember that anatomical planes can be very useful for thinking about what structures are located at each of these levels. In this table, there's only one that's relevant for the thorax, but some of these levels will be extremely important when we move down into the abdomen tomorrow or on Thursday and then next week. So looking at the sternal angle, again, that's T4-5 vertebral level, usually right about the level of the IV disc between the thoracic vertebrae T4 and T5. The structures that are located there, it's going to be the location of the tracheal bifurcation. The aortic arch begins and ends at that level. The pulmonary vasculature is going to bifurcate, so the pulmonary trunk bifurcates at that location, and then the azygous vein links up with the superior vena cava at that level as well. The transpyloric plane, remember that's going to be a level running through the pylorus of the stomach. That's going to be located at the L1, L2 vertebral level. And so some of the structures that are located there include the superior mesenteric artery, the portal vein, hilum of the left, and usually, or sometimes the right kidney, and then also the fundus of the gallbladder are located in the transpyloric plane. The subcostal plane, remember that's going to be at the very base of the 10th rib. That's going to be the L2 vertebral level, and the main structure that you'll see at that level is going to be the IMA, or the inferior mesenteric artery. The supracrystal plane, that's going to be located along the iliac crest. That's located at the vertebral level L4, L5 or so, and that's the location of the aortic bifurcation. And then the pubic crest, the plane located at that level. The vertebral level at that point is the tip of the coccyx, and so other structures you'll notice at that level include the femoral head, ischial spine, and the center of the acetabulum. So when we talk about these related structures, I just want you to keep in mind that these structures are typically located within 1 centimeter above or below the plane identified. So when you're looking at a CT or MRI of the thorax, there's 6 key levels that you want to pay attention to, and I think each one of these, if you know the structure is located at that level, it makes it much easier to be able to determine what each structure is. And so the next video will be going through each of these 6 levels.